Good afternoon, everyone, and thank you for joining us today for this rules workshop. I'm Amelia Boyd, and I am the program manager for the Commission and the organizer for this webinar. This meeting is being recorded and will be made available sometime next week. The documents which will be discussed here today are available in the handouts section. All attendees are muted. Panelists may unmute themselves and share their webcam. Attendees, if you have a question, please use the raise your hand function or use the question section, and we will get to your questions as quickly as possible. At this time, I will begin the roll call of panelists and staff. When I call your name, please introduce yourself. First up, Heather, if you would introduce yourself.
Yeah, this is Heather Carter. I'm an Assistant Attorney General and Legal Advisor to the Commission.
And then Dr. Chung.
I'm Jimmy Chung. I'm a general surgeon and one of the members of the commission.
And then Mr. Malden.
My name is John Malden. I'm a member of the commission and current chair.
And Melanie.
I'm Melanie DeLeon. I'm the Executive Director of the Medical.
And then Micah.
Micah Matthews, Deputy Executive Director of the Commission.
Then Stephanie.
I'm Stephanie Mason. I'm the Legislative Liaison and Public Information Officer for the Commission.
Thank you. And then Christine, if you would introduce yourself and then you can read the script.
All right. Good afternoon. My name is Christine Blake. I'm a public member of the Commission and will be the presiding officer for this rules workshop. Today is Wednesday, August 18th, 2021, and it is 3:33 p.m. This meeting is being held via the GoToWebinar platform. The rule being discussed today is regarding the requirements of Senate Bill 6551, an act relating to integrating international medical graduates, IMG, into Washington's healthcare delivery system. The pre-proposal rules package was filed in the Washington State Register as number 20-17-024 on August 6, 2020. Ms. Boyd, please give an overview of the rules process.
Thank you. So since this is the first workshop for this particular rule, we will talk a little bit about what is a rule and then why we are creating this rule. So as you can see on the screen, a rule or regulation is a written requirement that applies broadly across a group of individuals or entities that enables, guides, or directs them to do something or prohibits them from doing something. Specifically, a rule establishes or subjects individuals or entities to penalties if it is violated, or is a qualification or requirement that gives a benefit or privilege, or sets qualifications or standards that an individual or entity must meet to get a license or permit, or sets standards that must be met before a product or material can be sold. So why are we creating this particular rule? It is to meet the requirements of Senate Bill 6551, which is an act relating to integrating international medical graduates into Washington's healthcare delivery system. The specific subsection that we are dealing with is subsection 5 of section 5, and it says that the Commission may issue a time-limited clinical experience license to an applicant who does not qualify for licensure under RCW 1871-050 or Chapter 1871B RCW, and who meets the requirements established by the Commission in rule for the purpose of gaining clinical experience at an approved facility or program.
The next item on the agenda is to discuss the draft language.
Let me get that pulled up. So here's our very short draft language. And we did receive one comment earlier today, which we can talk about after we talk about this draft language.
Amelia, would it be helpful if I kind of gave a little background?
Absolutely.
Okay. So Amelia did a great job in talking about where this directive came from, which is the clinical experience language, or clinical experience license that was asked for in Senate Bill 6551. However, between between the time that Senate Bill 6551 passed and now a bill called House Bill 1129 passed. I believe it's 1129, it might be 1192. But either way, that one created, well, I'm sorry, let me back up. 6551 with the International Medical Graduate Work Group, we developed draft qualifications and requirements that were going to be adopted into rule for this clinical experience language. The bill, the House bill that passed in the interim, basically took all those requirements and placed them into law in the new sub 6 of this same section that was amended by 6551. So that's why the language in front of you is basically saying the requirement to do rulemaking for the commission that is stated in sub 5 for clinical experience language, we're pointing them to the requirements now listed in sub 6, which is the bill that passed, the House bill. So that, I don't know if it would be helpful for you all to see that, but that's what we're doing, is we're saying this requirement is satisfied by the very next section, which passed after Senate Bill 6551. So I know that probably sounded a little confusing, but I'm happy to answer any questions and try and clarify. It's easier to see now that Amelia's got it on the screen. So your rulemaking requirement is in sub 5, and sub 6 is what was added this last session.
And both of those bills are in the packet for this workshop. So basically what we are saying is that the requirements, we adopt the requirements that are in sub 6 in our rule that satisfies sub 5. I will put them side by side if that's a little better.
And with respect to the implementation of House Bill 1129, we have a staff work group putting together how to implement that. We anticipate that we will be able to launch that credential by next month. We are calling it the MD-CE, or MD Clinical Experience License, and it should have a so-called paper application ready to go next month. It should be an online application starting December. You will also tomorrow see several items on policy with respect to an interpretive statement proposal, as well as a policy proposal to help facilitate implementation of the language that you have in front of you.
Were there any additional questions or comments anywhere?
So there was one comment we received today. Let me pull it up. Sorry, it's super tiny. I'm gonna have to make it bigger.
I think the answer to their first question is yes, if they meet all the requirements in sub 6. This is the second, with respect to the second question, this is, I think, the second thing I've seen about the exceptional qualification waiver. That I don't think that's up for discussion at this particular juncture, Amelia. I don't know what the 101 states specifically, but I can say that the IMG work group considered moving forward on both a hardship exemption for the application as well as the exceptional qualification waiver, which was directed in the statute, and they chose to not pursue either of them beyond saying with the exceptional qualification waiver, they didn't want it to use it to open up broadly the ability for people to waive the residency requirements in rule.
So does this apply to PAs?
Right, that was going to be my question. This is a PA.
This is a PA who's a foreign trained physician.
Okay, so he's got both.
So you cannot go through ECFMG in my understanding without being a foreign trained physician.
Gotcha.
So and he wants to then work under the physician license here, obviously not the PA.
Correct. The ownership piece may get a little tricky if they try and apply as a clinic that they own and be their own letter of reference or recommendation. I think we would call that a conflict.
Yeah, that's where I got confused, whether they wanted to practice as an MD or whether it's their PA license. Yeah, because of the ownership.
Yeah, to be clear, they would have to practice under the MD license, but they would have to have a supervising MD to do it, who is not supervising the PA license, but supervising the MD-CE license.
Okay.
Do the supervising MDs need to work in the same clinic, or can they be remote?
I don't believe there's a restriction on remote. And to be fair, there's not a restriction on remote for PAs anymore as of July 1. That was deleted from the law. So at this point, we're designing the clinical experience license with a PA-like practice agreement model. So there could be some remote work on there, but there is a restriction currently on the number of MD-CEs that may be supervised. I believe it's 4. It says clearly in the law, but at this point, the physician cannot supervise more than, I believe, 4 MD-CEs.
I thought it said no more than 2, and I didn't see any language with regard to remote or in person. It was just not addressed, but I was just curious if there was something else that addressed it.
So we have several comments in the questions section. The first one is, it seems this person does not have step 3. ECFMG is till step 2. And they need a step 3 for House Bill 1129.
That's correct. So that's why I said they would have to meet all of the requirements for House Bill 1129.
Right. And then it says they have to be in the same organization, remote or otherwise. And then someone else commented and said the bill stated direct supervision, so that would seem to prevent remote.
Right, Mr. Malden, you're correct. It did say 2 license holders. I'm sorry, the ratio is 2 to 1. I'm sorry.
Yeah, and I don't recall it specifically saying remote or in-person supervision. You'd have to interpret what direct means, I guess, or define what direct supervision means. But other than that, I didn't see where it addressed what type of supervision in terms of location.
Yeah, I'm not seeing the direct piece. I'm seeing under the supervision and control of physician.
This is Heather. That's all I see too, is the supervision and control. Yeah.
So they're saying it's within the nominating facility or organization. I think that's what they, so if the facility is remote.
I suppose you could have a facility with multiple locations.
Or an organization that has multiple locations.
Right. So that's a little unclear, but maybe it was
Yeah,
purposely left unclear.
possibly. The practice agreement is certainly going to be asking a specific of what is the model of supervision you're proposing.
So the practice agreement is, I think you mentioned similar to the PA agreement, but is there one specifically drawn up for IMGs and supervision at this point?
It's not completely designed, but it's going to be modeled after that for sure. We're lifting the relevant portions and adapting them to what the law is stipulating.
Okay.
Do we have an ETA on that, Micah?
It should be by the beginning of September.
Okay.
But at this point, we're trying to deal with the IT challenges of asking DOH to create a brand new credential like now.
Right. So there's no other questions. Does anyone have any comments about how this language is worded? If no, so our other discussion is we can either create a new section, which is what we had proposed in this draft language, or we can add, I mean, I'm not sure how you want to go, whether you want to create a new section or if you want to add it to this WAC, this 340. You can go either way.
Does Ariel have to be on the call?
She is. I can make her a, let me find her.
As someone who used to work for the code revisor, I think we should get her input.
Let me attempt to add her as a panelist.
If we could, it would make sense just to add it right in there, but see what
Okay,
Ariel
she
has
is.
to say.
This is Ariel. So the 340 is additional requirements for international medical school graduates. While you could change the caption there to make it broader, this is a different type of license. So I would recommend keeping it separate.
Thanks, Ariel.
And 345, that number is available. So that's probably the number we would use. And then we do have a question. Is this tuition based or would limited license holder get salary?
That is not up to us.
And that's the only other questions we have. So I'm guessing we're okay with this language.
So that's it on the questions, Amelia? Nothing else?
That was all we had. Unless anyone else would like to comment. There's no hands raised.
Okay.
I don't have a real problem with the language. It just seems a little awkward when I say may issue a time-limited clinical experience limited license. It make more sense to say issue a time. I don't know.
I know
What if
what
we
you're.
just deleted the?
Yeah.
What if we just deleted the
Yeah.
time-limited conversation entirely? Because the statute makes it clear about that.
Yeah. I actually, John, I was kind of looking at that too, but I thought, well, there might be a reason why it's said twice, but yeah.
This is a little cleaner, I guess.
Yeah.
This is Heather. And this may not be part of your 101 here, but it talks about approved facility or program. Is there an approval process, or is that?
That would be the policy that they're considering tomorrow.
Gotcha. Thank you.
Which I can pull that up if you guys want to look at it, but you are going to review it tomorrow at policy.
Yeah, I like that wording better, John. And you're on mute.
I just wasn't getting the right
Yeah.
jive, you know?
Yeah. Yeah.
So is there anything we need to add to this? I think it's pretty simple that we're directing them to this. Now, I will say that RCW 1871-0956 has not been codified yet, so.
I always
I like
like,
I have a question though, and I'm sorry if this was discussed maybe some other time, but is there a definition somewhere for clinical experience?
Let me look.
And the other question is, and I don't know if we even want to go down this route, but is the clinical experience in the in the setting of how defining it in terms of education, or is it defining in terms of patient care, or both? Because I know there's language about residents, but it's unclear what this clinical experience is supposed to be.
So, Dr. Chung, the intent of this is for an IMG who is satisfied otherwise everything except a residency, and generally what they're facing is it's been a long time since medical school, or longer than the normal applicant to residency would have, and so this is intended to allow them to get hands-on clinical practice before a residency to show that they still have skills and that sort of thing. There's also behind the scenes here, there's going to be an assessment or a suite of assessment and evaluation recommendations coming to the commission from the International Medical Graduate Work Group to basically assess them clinically and rank them, so the residency programs will have that information as well. So it's kind of supposed to act as a refresher and make them more appealing candidates for getting placed in a residency.
So this is a license before residency.
Right, a limited license to gain that clinical experience. When the discussion came up a few years ago about getting them in without a license, there was a bit of heartburn about that from the liability side, the supervision side, and the billing side.
So I don't want to argue the statute because I know that's out of scope, but I guess I'm not understanding what clinical experience are they expecting someone to have before residency? Like, you know, because before residency, you're a student. And as a medical student, you do clinical rotations. And in those cases, you wouldn't have a clinical experience other than what is being taught to you by the attendings. And so is this supposed to catch you up to the clinical rotation level clinical experience? Or I guess I'm a little confused as to what that clinical experience is supposed to entail.
It's to my understanding, it's supposed to get you to, because these folks, you know, they're typically not fresh out of medical school. You know, the examples that were given during testimony were folks that had been here for quite a few years and maybe had practiced as physicians for some time in other countries, but just simply don't have a residency here and therefore are not eligible for licensure. So that, as I understand it, was the intent of also placing the 4-year limitation on this license. So it provides them an ability to get back into the workforce, get those skills with supervision. Think of it as proctoring, as you will, and then make them appealing to a residency appointment.
Right. No, I get that. But if that's the case, then basically what you were trying to do is get them as equivalent to 4th-year medical school, basically, because that's what you are before you start residency. So,
right.
So is this clinical experience license meant to have them do that level? I mean, a 4th-year medical student, you're still a student.
Right. Without being able to speak for the legislature, I think that they were trying to accomplish both that and to get experienced IMG physicians into the workforce to some degree. And so I think that that's kind of where they approached it. I know that was part of the testimony that was given to the legislators was along that line.
Okay. Yeah, and I know it might be out of scope. I guess I was just trying to understand what the clinical experience was supposed to mean, but as is, I think the language is fine.
In the handout that it was attached to this, on pages 5 and 6, I think it might explain it a little bit more with regard to the commission issuing limited license to practice and what it permits them to do.
We also have a hand raised.
Okay.
Mohammed, if you'd like to go ahead.
Thank you so much. Yeah, I just wanted to ask Dr. Chung. Dr. Chung, this is Mohammed Khalif, President, Washington Academy, IMGs. So the intent for that clinical experience is that many residency program directors, for example, if somebody comes from, let's say, El Salvador, or comes from Kenya, or comes from another country, they immigrated here, came here as refugees, maybe they have been practicing like for 10 years in Kenya, but the program director might not see that experience as U.S. clinical experience. So they want experience for U.S. clinical experience. For the limited license, would help them understand how healthcare in general and patient care in the United States works. And the intent for that was to help them get more competitive towards residency with this license. So just wanted to give an overview of that.
Yeah, no, thank you. And I think I understand the intent. I just wanted to know if the term clinical experience was defined as such somewhere, such that that intent was clear. Because it's not entirely clear that the purpose of this was to get somebody ready for residency. It sounds like it almost sounds like after this period they would qualify for a full license, and I'm not sure if that's been clarified anywhere either.
Yeah, and from my understanding is the limited license expires in 4 years. So it's not open-ended, it has like a 4-year limit. And also there's supervision practice agreement. So the intent was, I think, for the supervisor to define that clinical experience and how that would work, rather than put it into statute.
And to be clear, the license expires in 2 years from the date of issuance and can be renewed once upon renomination by the organization.
So one of the questions that is in the questions is, if I'm an applicant and want to apply for the license in 1129, how can I choose that since the qualifications are the same for 6551 and 1129?
There will only be one option, which is just the MD-CE license. They will simply just apply for that one. It's going to be a separate application. And all this rule is doing is saying that the clinical experience license that we are directed to establish rulemaking standards for, the standards exist in sub 6. And so it makes it clear where people need to look for their qualifications. But if they need to look elsewhere, they're certainly going to be on the application.
And then I will just say that I could not find a definition for clinical experience in either bill.
Yeah, I don't think that was defined by the legislature.
So is it something we need to define?
Seems like it's defined by where the candidate is working, and possibly by the supervising MD of whatever specialty that individual is, and I would think. So to define it, I don't know, I guess you could define it something like that. Seems like it is left open.
My only suggestion for why we wouldn't want to narrowly define it is because simultaneously to them doing this clinical experience work, the intent is that they're going to be having a clinical readiness assessment ongoing by physician assessors. And that information will also be provided to residency programs too. And there's a whole other presentation we can give about the readiness assessment program, but it's the standards are being presented by Dr. Powles and others from University of Washington, and they are in line with already accredited programs and what they do. I think Dr. Khalif could probably, if we could have him speak to I'm blanking on the name of the standards, but as I understand it, they are associated already with existing medical school standards.
You're unmuted, Dr. Khalif. You can go ahead.
Yes. So thank you, Micah, for giving me the opportunity to speak on this. So we are currently working on adopting the LCME Core Professional Activities Entrustment Scales that was recently published to look at the clinical experience of IMGs once they have rotated with supervising physicians in the state. So we do have a couple of ideas to implement that. and we will be presenting it in the work group. Would be happy to take any questions if anybody has questions on that.
Can the practice agreement define what clinical experience is or will be for an individual?
Yeah, I think that's the best solution for the physician to working with the IMG, because IMG skills are so different. So the physician working with IMGs knows their trainee, and they can basically include that in the practice agreement, or they can, without even including it, I think every physician is responsible to direct supervision and know what to give the IMG and what not to give. So I think both ways are okay, but I think to leave the practice agreement as it is and just give the trust the physician to make the right decision. I think that's a great approach.
Yeah, there, and in section 5 of the handout, it looks like there are some. It talks about different ways in which a limited license to practice might be granted.
Are you talking about on the 101?
Yeah, I think so. Yeah, let me look. Let's see what I'm looking at here. I'm looking at page. Big seem to figure out the page of the handout. Senate Bill, it's 6551. And when I was looking at that on page 4, says the commission may, without exam, issue a limited license to persons who possess the qualifications set forth herein. And then there are 4 different examples of
Right.
yeah.
So
Of what those are.
1871-095 is our limited license section of the law.
Mm-hmm.
And so anything that's not underlined is, if we could go back to the other thing, anything that's not underlined is existing statute and not new.
Right.
And so what we have there is residency, fellowship, teaching and research, local, county, health, institutional, and I'm probably missing one.
Yeah, you do.
But those.
I'm sorry. Go ahead.
But those are all the existing limited license ones, and so this one was tagged on as it is considered a limited license, as in time limited and under supervision.
Yeah. So would those be examples then, Micah, of something that they could get this limited license for, or no?
They would be able to get a residency license if they are nominated by the residency program. Same goes for fellowship. Teaching and research is they have to be nominated by a specific set of individuals that are listed there. Mm-hmm. Really, what it's talking about is without an exam, and so that's basically allowing folks to go in and do patient care in those settings, or not in the case of research, and without having to pass USMLE or any of the other exams. In the case of the clinical experience license, there is a requirement that they pass all steps of the USMLE. Now, as was pointed previously, when they complete ECFMG, that means that they're completing USMLE steps 1 and 2.
Okay, so we tagged 5 onto this one. Okay. Okay, thanks.
No problem.
Are there any more questions or comments?
There is one that says, is scope of practice, I think it means if scope of practice is the same, i.e. clinical experience in both bills, why are there two bills? And so I was starting to explain that one's from last year's session and then one is from this year's session, and they decided to add requirements in there for this year's bill. But the previous bill, 6551, says that we had to do rulemaking. The new bill doesn't. So,
Okay.
Yeah, the new bill basically took it out of our hands
correct.
without deleting the requirement that if we were to establish such a license, that we would have to put the requirements in.
Correct. That is all the questions. There are no other hands raised. So now I think we can move on to the next part of the script, Christine.
Sure. Since there aren't any other questions, thank you for your participation, and Ms. Boyd will discuss the timeline and next steps.
So the first thing you need to do is vote on this language, whether you like it or not.
I move to approve.
Second.
Okay, and then let me get my other stuff up here. I'm having to move things off my screen. Then we will talk about what will happen now. Okay, so our rule development timeline is on the screen. This will likely be the only workshop we have unless something changes between now and November. We will present this draft language at our November meeting, at both the policy committee meeting and to the full commission at the business meeting. We assume they will approve it, and then we will move to the formal proposal, which is the CR 102, sometime in December. We hope to get that filed. Probably it would be late December, early January, and then we hope to have the hearing in February, and then by April we will adopt it, and then the rules will be in effect probably next June or July.
Okay, thanks. Are there any more comments? Anyone wish to? No comments, questions before we?
There's no new comments and no hands raised.
Okay, then I will close this workshop.
Thank you, everyone.
Thanks all.
Thank you.
Thank you.
Thank you.
Bye.
Thank you. Bye.
Thank you.